take NHS 111. That's a really good example, Tom, and we could spend an hour just talking about NHS 111. I'm struggling to think of something that's more significant to the audience that's out there now that's less familiar. Okay, so I'm wondering how many companies, not a criticism, because the same could be said of MTech Access. When was the last time we looked at the algorithms and what they say? So if I ring up and say, I'm a middle-aged man and I've got a certain symptom, okay? It is a national algorithm across England of how that call handler handles my call. You can have local 111, but quite often, I live in the north of England, I could ring up, the person answering me could be in Hampshire. Right? So people don't understand enough about these systems. Now, in a world where that call handler can actually book me in with my GP and explain to the GP directly why they booked in an appointment for me to see that GP, I think companies need to be much more aware of this and who the providers of 111 are, because we both know there's several providers. There's one main one, but there's several. And I think we've got to see this. This is all part of the integrated aspect of the NHS. You know, you and I often sit down and we do it now through this kind of medium, and we say, there's NICE, there's SMC, there's that, there's the formulary, there's that, and we work our way through, and it ends up with somebody ringing up and saying, I've just been started on a drug, and then it does this, and I've had terrible diarrhea or headache since. What does the call handler say? Do they say, stop taking that drug immediately, go and see your GP? Do they say it's going to be okay? Do they say, go along to your local chemist? You know, these things are just as important as the NICE guidance or something that the GMMG says. Yeah. And it's about the peripheral vision that we all need to have. So I know I haven't answered everything there. I don't want to go to, but just that one aspect of 111, I don't think there's a company listening to this, including us, who shouldn't be. That's one example. You know, then other things that we should be focused on, like the rationing, there's so many things at the moment that we really need to urgently drill into.
Yeah, and there's probably huge amounts that comes through 111 or that goes to 111 that doesn't actually come through the other end. It doesn't translate into HES or into practice data because it's closed off there and then it's resolved on the phone. So it might be that call which names a specific medicine or a specific condition or a specific problem that then isn't counted in any statistics beyond that. So yeah, that'll be really interesting to see how far 111 goes, because it's kind of nominated, particularly in light of what Matt Hancock said yesterday about every consultation should be remote at first, and 111 is going to be a large part of that, and triaging before anyone goes to A&E as well.
Yeah, and I just quickly on that, you know, I'm trying to think how many people listening here have been in a 111 call center, okay? Because when you go into them, yeah, you've got call handlers who work into strict algorithms. Sitting behind every 4 or 5 of them is a very experienced. It's somebody a bit like me, an older nurse, okay, in their sort of 50s, but much better, proper nurses who have been around a lot, and they're sitting there and they're monitoring the calls, and they don't necessarily work to algorithms. It's one of the fictions, and you have doctors there as well, and you think, so what are they saying when somebody says, oh, I've got an adverse event potentially, or I don't feel very well, or I want advice? These things can be crucial. And it is just, let's not get too caught up in it, but it's one small example. And I wonder if companies out there know, well, who runs 111? And as you said, I don't think there's any limit to what Matt Hancock will want to put through 111.